Hello and welcome to our Personal Development in Care training course. In this module, we will get into the concept of the Personal Development Plan, PDP, and its significance in your professional journey. We'll talk about the process of developing a PDP, highlighting the steps involved, and the importance of setting clear goals and objectives. So, what are we waiting for? Let's begin.
First of all, what is PDP? A Personal Development Plan, or PDP, is an action plan that helps to get organised, identifies learning and development needs to help you do your job better or help in your career, and then tracks progress. Personal development happens throughout your life. At work, it starts with agreeing on your aims and objectives and thinking about your strengths and development needs. You can then set goals so that you can meet your objectives and make the most of your talent.
Now, the question may arise, what is the typical process for those new to health and social care? Well, for those new to health and social care, the care certificate is the beginning of their learning and will usually form part of their induction. Anyway, let's take a look at the steps involved in developing a PDP.
As a first step, you will have to agree with your employer on how you are going to complete the care certificate, including how long it will take. Then, as you continue to work in health and social care, it will be important to develop skills and abilities. This may involve further training, specialist courses, and qualifications. Your employer will know what they expect from you and will help to set targets and find the learning you need, and so will create your PDP with you. The majority of PDPs cover a 12-month period and should therefore be updated and renewed each year. The most important person involved in the PDP is yourself. However, your manager, other workers, and the people you provide care and support for will all play a part. In order to agree with the PDP, you need to ask yourself questions such as: what do you want to achieve? What are the standards, skills, and knowledge needed by your current role, and do you have any gaps? What are the learning and development opportunities in your current role? What are your ambitions and goals? Are you making the right choices to get yourself there?
Another term we hear frequently in the professional sector is CPD. What is it? Well, CPD stands for Continuing Professional Development. Let's see what it entails.
Continuing professional development refers to the types of learning activities that professionals engage in order to further develop their skills and abilities. Professional development courses, industry conferences, training seminars, e-learning programs, and brainstorming sessions are all examples of CPD learning approaches. CPD helps learning to become aware and proactive rather than passive and reactive. This is facilitated by incorporating occupational and practical qualifications with academic certificates. It is a crucial component of continuing to develop oneself after completing formal education.
That's not all. CPD allows individuals to reinforce and improve their current abilities while decreasing knowledge gaps, giving them a competitive advantage in situations where one is required. CPD can also help individuals stand out in the job market, as many candidates seeking specific opportunities frequently have comparable basic skills. You will get to learn about more benefits of CPD from our resource section. But before developing a PDP or strategizing for CPD, it's essential to identify the skills necessary for your professional growth. As a healthcare professional, possessing this knowledge is paramount since these skills are becoming more important in professional life.
These skills can impact your career prospects, job performance, and other lifestyle activities. Employers are increasingly looking for these soft skills in addition to qualifications. The skills that healthcare professionals need can be divided into two categories. 1. Personal skills, and 2. Health and social care skills. Firstly, let's focus on personal skills. In healthcare, these soft personal skills can be more important than certain technical skills. So, what personal skills do healthcare professionals need? The personal skills that healthcare professionals need include empathy, communication skills, team player, dealing with pressure, strong work ethic, positive mental attitude, time management, self-confidence, dealing with criticism. Next is the health and social care skills. Health and social care skills include the ability to draw together, analyse, and critically evaluate information, communicate effectively with individuals, groups, and organisations, produce accurate records and make informed decisions, think logically and propose reasoned solutions, put together well-judged arguments and question assumptions, manage time, learn independently, and use ICT effectively, work as part of a team and take on responsibility, write concisely, clearly, and accurately, interpret, use, and evaluate various types of data, relate the knowledge gained to situations in health and social care.
Apart from the skills we've discussed so far, there are a few more that are collectively known as core skills. Whatever your health or social care workplace, it's important that you have the right level of literacy, numeracy, and communication skills.
In a healthcare setting, individuals are required to effectively interpret and contribute to care plans, record vital data accurately, and communicate information clearly. This includes tasks such as monitoring weight, tracking vital signs, and understanding and performing basic measurements and conversions. So how can you develop your knowledge, skills, and understanding? Well, the internet has a number of websites where you can check literacy, numeracy, and communication skills and get help to develop them further if needed. Non-web-based materials and face-to-face learning opportunities can also be found. You might be expected to have skills at a specific level in your role and be provided with support to improve the skills. You should ask your manager if there are any particular opportunities, resources, or support available.
However, assume you are an employer looking to hire someone with these skills. How and when should you assess them?
Well, literacy, numeracy, and oral communication abilities should ideally be assessed during the recruitment process. This is a simple and quick process. The best technique is to have the person read something, then write a response, and then talk about what they wrote. This can be used to check literacy, numeracy, and oral communication skills.
It's important to recognize that these skills serve as a foundation for establishing clear objectives in your personal development plan. Objectives are the things that you want to achieve.
Objectives are easiest to agree on if you keep them SMART, which stands for specific, measurable, achievable, relevant, and time-based. Once the clear, SMART objectives have been set, it's time to break them down into manageable action points and record this information in the PDP.
As integral components of professional development, supervision and appraisal play a pivotal role in ensuring alignment with the SMART objectives previously set. These structured sessions not only provide opportunities for performance review and goal adjustment, but also serve as platforms for refining the Personal Development Plan, PDP, to reflect evolving priorities and aspirations.
When you are carrying out your work activities, you'll be supervised by a more senior member of staff. Supervision has two meanings in social care and health work. Firstly, working under supervision, which means that you are working within the sight of a more experienced worker, not necessarily the manager who is overseeing your work. Secondly, supervision sessions, which are pre-arranged meetings between you and your manager or supervisor in order to discuss your performance and development. Supervision sessions are a regular opportunity to talk through any part of work, role, or about the individuals you provide care and support for. Your supervision might take place one-to-one with your manager, or in a group or team meeting. On the other hand, sessions take place at a time and frequency agreed with the manager, and notes should be kept. Regular supervision is important to any job, so concerns can be addressed, progress checked, and additional support arranged.
Whether your work is in one location or within the community, your employer should ensure that you have regular supervision opportunities. Now that you have a clear understanding of why supervision is important, let's shift our focus to appraisal.
An appraisal is a one-to-one meeting, usually once a year, between you and your manager, which reviews how well you are working and making progress. At this meeting, the manager will plan the next steps and update the PDP.
As we've explored the significance of supervision and appraisal in guiding professional development, it's also crucial to understand the value of constructive feedback in fostering continuous improvement. Let's delve deeper into the pivotal role of feedback in facilitating learning and growth.
You need helpful feedback when joining a new workplace and learning new skills. As you progress through the care certificate and your induction, you should receive regular feedback from the manager or assessor. This should help you to develop skills, provide clarity, and give you the ability to meet the standards required.
But what will happen if you don't receive any feedback? Well, not receiving any feedback can lead to a false assessment of your own abilities. So it can be said that receiving feedback is crucial. Let's look at what receiving constructive feedback from clients, informal carers, colleagues, supervisors, and trainers enables to obtain a better understanding of its importance.
Receiving constructive feedback about the work performance from clients, your supervisors, trainers, and assessors helps you to develop a realistic evaluation of the abilities, improve your self-assurance and problem-solving skills, recognize your own talents as well as places for progress, improve the abilities, and give you clarity and the ability to meet the required standards. Feedback can be both formal or informal. Formal feedback would usually be given in writing. This might be part of an assessment or appraisal or on a comment sheet. Formal feedback is also given verbally in supervision sessions, but is then written down in the notes of the session. On the other hand, informal feedback happens in day-to-day discussions with work colleagues, managers, or the individuals that you provide care and support for. The most helpful feedback is always given positively and is constructive. It should be based on the facts, describing what you could have done differently or what you did well. Presented delicately, fairly, and proportionately. And focused on how to change instead of personal factors such as confidence or intelligence.
That brings us to the end of the module. However, our learning journey is not yet complete. In the upcoming module, we will focus on various aspects of learning and development, from self-learning techniques to understanding different learning styles. Stay tuned for more enriching insights, and don't forget to check out the resource section for additional in-depth knowledge. See you soon.